Welcome to Behind the Mask, episode 7, where real plastic surgery experts break down real-life cases from the most bizarre to the hottest trends. We're going to take you behind the mask to get unfiltered analysis from our experts. I'm your co-host, Dr. Bill Adams, and with me is my incredible, legendary team, my co-host, the world-renowned Dr. Jason Posner from Boca Raton, Florida, as well as our special guest expert and Dallas plastic surgery consultant, Ellery Milliger. Our first clip today comes from none other than Botched, where a lot of highlights come from, but this is on the most famous, in quotations, Instagram models who have appeared on the show. So let's take a look at this.
I went to Czech Republic and I had liposuction to my stomach, liposuction to my back.
Yeah.
I had 890cc boob job.
Okay.
Then I had my ass redone as well, so I got 600cc's in there.
But by the way, that's a lot of surgery. You have it all at one time?
I had them over the space of a year.
Okay. You have any complications?
I'm starting to get rippling effect on the side of my breast. This one has kind of dropped slightly as well.
It's lower?
Yes.
Okay.
It's a big deal for me for my body to look on point because I take pictures, so I still want to go larger.
How much larger?
1,200cc. That's my dream goal. I don't want to look like a mom. Do
Right.
you know what I mean? I don't want to look like I've had a baby. I don't find the mom bod attractive. It's not my thing. I'm not frumpy. I'm fit and fabulous, and that's the way it's going to stay.
Jason, what do you think?
I mean, I think that, like, do they have a call out for every weirdo in the world to go on that show? I mean, come on. I mean, like, that's like a not a normal like, she's okay. She wants to have big boobs. Okay, that's what she wants. So why is she having a problem with her big boobs? Are they one up and one down? Do we need to fix that? Do we need to downsize her? I mean, I don't really understand what they're talking about. Made no sense to me.
Well, how'd she have that many procedures in the span of 1 year? That seems a little dangerous, first of all. Unless it was all together, I guess, then it's kind of a different story, but
She
just
sounds
that
like
was interesting.
that's like not a normal patient that we see in our practice. That's like one of these attention-seeking people on the social media.
But her complaint about her breast looking different, who's gonna tell her that the more plastic surgery she does, probably the more issues that are gonna arise?
We got good ways of fixing problems from meshes and things like that. And I don't even see what was her problem. But I mean, she looks too big. Downsize her a bit and try to fix her up. But I don't know what the problem is.
You know what? That is it, Dr. Posner. That is social media. It's a lie. We don't see the problem because you don't see that in the photos or in the push-up bra.
I think Behind the Mask, episode 8, we need to have Moms of America on because I don't think they're going to be happy with all the venom coming from her. But
listen, you got Dallas and I have South Florida. We see very attractive, in shape people after kids who want a little tweaking, and that's what we do. That's the mainstay of our practices.
yeah, I mean, it's just a different world. I mean, these people, first of all, Botched is just, I mean, not only are the patients they have on there looking to become, well-known and notoriety through kind of extremism, that's what Botched is trying to do to get, viewers and clicks on the show. So it's like a multiple of exponential effect, but it's certainly not reality.
It used to be that you got likes just because you were like, Happy Mother's Day and you're just posing with your family, or you got your dog, and now it's like,
I watched this one guy on Instagram from California, and he's got like a 20-foot snake. He works at a reptile place. Like, that's pretty cool. 20-foot.
That's the content I want to see. This is a reptile plug.
There's not much more we can say about this one. So we're going to go to the next topic, which comes from Fox News. Famous celebrity Sharon Stone says a plastic surgeon gave her larger breast implants without her consent. And she shares this ordeal in her memoir, The Beauty of Living Twice. And this is interesting for, multiple reasons. So Jason, let's discuss this.
I mean, it doesn't make any sense to me. None of these clips really do. Like, you go into a surgery, you decide on the size of the implant with your surgeon, and you go through your preoperative preparation, and you go with what you discussed. I mean, I know Bill likes to choose a specific size of implant prior to going in. I like about a 50 to 60 cc range that I say, and I use sizers, you don't, but this is all within the scope of good plastic surgery practices. Patient goes in, I might say you're getting between a 400 and a 450. I'll see what looks good. It gives me a little leeway to to work with asymmetric problems, but they go in, they know what they're getting. And we do extensive sizing and teaching prior to surgery. I mean, I don't understand that the guy put in larger than she wanted. That was bad communication between her and the surgeon.
In your case, Dr. Posner, if you're giving kind of a range of size and use sizers and you decide in surgery with your expert opinion, those patients are consenting to that range, so there's no surprises. And it sounds like in this situation, it was something she didn't consent to. I don't know, I actually talked to quite a number of patients that say that they came out of surgery and they felt taken advantage of because the doctor went way larger, and then they let years pass, and it just is psychologically hard, and it damages your breasts in the long run, the breast skin, tissues. So I think that, you just have to trust your surgeon.
Yeah, I think also I'd say we need a little bit probably more information from the story, because so her surgeon gave her a larger breast implant. Well, what does that, I mean, let's just say, for example, she thought she was getting 300 and she got 310. Well, that's inconsequential difference, and if there's for some reason somebody thought that she needed, or, just like you're saying, Jason, and Ellery, you're kind of saying in a little different way, that if in the discussion the surgeon truly feels that she's going to get a better result with a slightly larger size, then there's no foul there. Right. But other side of the coin, if Sharon Stone's had a conversation before, she goes, this is as high as I'm willing to go, and I do not want an implant bigger than this size, then it becomes a little bit more of a problem, especially if it was 100 cc's more than what she said she was willing to go. So who knows? The truth is somewhere in between probably, but we always say that patient education is the most important part of the procedure, and it's just the start of the process, and you have to, and so that education part is kind of gaining trust in the patient, as you're talking about, Ellery, and the surgeon and the patient having a rapport, and like you were saying, Jason, that everybody has a different way to do it, but at the end, when you go to surgery, you and the patient should be comfortable what the plan is, and the patient trusts that you're going to do the best job you can, and that's generally what happens, and usually there's not a problem. But I think this is, I don't know what to say. I'm not sure we have all the facts.
The other side is experienced surgeons who have long-term practices probably do a good job with their patients if they have good reputations and good referrals from other patients. I know Bill does a great job because he's got a wait list of patients and he's a full practice and he got a lot of referrals. That's the true task of a really good surgeon, not someone that's advertising on social media and feeding their surgical schedule from that. I mean, after a while, if the patients aren't referring their friends to you, you got a problem.
Well, and just, going back to, needing to hear more than one side, there are situations where the surgeon needs to make the call to go larger. I mean, it was consented on the front end, so there are certain circumstances where you do have to modify the size in surgery once you get in there. So unless it was something absurd that was not consented to or discussed, we should also note that there are some circumstances where the surgeon needs to make a call in surgery.
I've been in a situation where a patient says it's a revision case and they say, well, I have 300s in, and I want 400s. Okay, you get in there and you find 600s in. And then what do you do? But we're definitely in that situation sometimes where they give you poor information going in, and it may have been one surgery was a 300, but you've had 3 or 4 since then. So we've probably all been in those situations where like, oh, surprise, surprise, surprise.
Yeah, and we're all so literal. Who knows what the situation is here. The other thing you all are talking, I mean, what if this is Sharon Stone's publicist just goes, let's float this story out here to get some clicks, get more publicity. Who's put that by, Hollywood publicists that they're going to like distort the truth just to get, publicity for a given celebrity, So if that's the case, it's a complete gong show because it's at the expense of whoever a surgeon is, which is easy to find these days. And, so that's unfortunate, but hopefully that's not the case. So let's go to our last story. This is on the breast implant checklist. So we've actually talked about this on other plastic surgery channel shows. because it was actually originally brought up about 2 years ago at the breast implant FDA committee meeting. And I was actually there representing the Aesthetic Society. And a lot of patients got up and patient advocates got up and said, like, we had the surgery and we got these 50 pages of informed consent. And they were, undiscernible. It's impossible to understand everything. It's too complicated. And we want a breast implant checklist, something really short that goes through the risks of the procedure that makes it easier to understand. So that sounds like a great idea. But the discussion point is that there was a New Beauty article, and it was kind of about in Arizona, they had some legislation passed where there's been a breast implant checklist that's gone through some part of the legislative process. And I actually saw this, and I think you all have seen it too. It's like ridiculously complicated, 9 pages long. And so the real discussion, I think, is what exactly constitutes a checklist, and what are patients actually asking for, Ellery?
Well, a checklist is a checklist, so it needs to be simple. So you said it was in Arizona, or where was
This
it?
happened to me in Arizona, but this is there's discussions going on all over the place in the United States on this topic.
Okay, I think that in order to actually get through to your patients, or just like anything in today's society, nobody's gonna watch a long show, read a long pamphlet. People don't even read anymore, honestly, which is not okay, but you need to make it simple, make it bite-sized. There's very important things that a patient needs to assess before going into a surgery and getting implants for the first time. So it needs to be attention grabbing. That is making an informed decision, just reading a simple checklist.
Jason?
I think I think sometimes people get lost in the minutia and they don't understand the basics of what they're getting into. I think they're worried about some weird thing down the road rather than the basics that these things have a limited lifespan. You have a risk of capsular contracture. You have a small risk of infection. Those are the main things, plus some others that you need to know. You don't need to know that in the, some of the little things that you might be in the consent that you should read that are not as important. So I think we need to weight the checklist to actually the more important things up front and maybe the less important things at the bottom of it.
Yeah, I think that everybody in this discussion, including us, but I'm just saying globally, should really look to industries that have used it effectively. And the number one is the airline industry. Because you go into pilots, they're like, flaps, check. Next thing, wheels, check. They say flux capacitor, check, but they don't go flux capacitor. This is a thing. It's put together like this, and it has a 15% chance. Like, they don't go into all the details because it's a checklist. Sometimes I tell my residents, the more you understand something, the simpler it gets. So I think simple is more in this. Patients, they have their informed consent. That's a completely different process and document in what they sign. But the checklist needs to be 1 or 2 pages, very easy to understand, has all the top risks that they need to know about. And the patients see something on there that they want to find out more about, they can do it. But if it's like this Arizona checklist, completely useless to the patient.
For example, on the checklist could be these implants have a limited lifespan. Check. See paragraph 3B for further explanation in the informed consent. Something like that. You want to look it up, but at least the basic things that you understand that these things don't last forever.
That's great stuff, team, as usual. And thanks for joining us this week on Behind the Mask. You can see us on our YouTube channel or theplasticsurgerychannel.com. For Dr. Jason Posner and Ellery Miller, I'm Dr. Bill Adams. Until next time, we'll see you later.